Strokes are a serious health issue, and they can happen to anyone at any age. It's even been recorded that babies have had strokes in the womb. People have strokes for various reasons. It's not always about blood pressure or diet. The effects of a stroke can be minimized with early treatment. This is why you need to know what you can do about a stroke as it happens and give the best chance for a healthy recovery. As the population grows and the chances of strokes increase, it's important to know how you can be proactive and reduce risks of a stroke for you and your loved ones. We'll talk about how to recognize stroke symptoms and what you can do for stroke recovery today. If you haven't already, please consider subscribing to the channel and liking this video so more people can find it online. Thanks much. First of all, let's briefly cover this. What is a stroke? Strokes are events that interrupt blood flow to the brain. Some people make a full recovery, but most survivors experience some degree of disability. Strokes can be caused by a blood clot or when a blood vessel breaks. Anyone can have a stroke. They are the fourth leading cause of death in the United States. That's an alarming statistic, but the good news is that 80% of strokes can be prevented. Recognize the basic symptoms. The symptoms of a stroke depend on where in the brain they occur and the intensity of the event. Common signs include sudden numbness, oftentimes one particular side of the body or face, or loss of movement, especially if it affects only one side of the body. Other indicators are mental confusion, headaches, or trouble with vision, speaking, and balance. If you think someone you know is having a stroke, get them to an emergency room as quickly as possible. The faster you react and get them to care, the better their chances are for recovery. A stroke directly affects blood flow to the brain, and every second counts. There are medical procedures that a hospital can apply to help a stroke victim, but many are dependent on how far along the patient is in the actual stroke event. The sooner they are in a professional's care, the better. Know the uncontrollable risk factors. Some factors are beyond our control. These include being past the age of 55 or having a family history of strokes. Men and certain ethnic groups like African Americans, Hispanics, and Asians are also at higher risk. Manage the controllable risks. Fortunately, there's a lot you can do to lower your risk. A healthy lifestyle will help keep your brain and whole body strong. Certain medical conditions like diabetes or high blood pressure also contribute to the likelihood of a stroke, so that's another good reason to manage them correctly. Distinguish between different kinds of strokes. There are two major forms of stroke. An ischemic stroke event is related to a blood clot and requires restoring the blood flow. A hemorrhagic stroke event indicates bleeding and calls for controlling blood loss. Find out about something called mini-strokes. The technical term for mini-strokes is transient ischemic attacks, TIA, where a blood vessel is briefly blocked. Up to half of all strokes occur within 2 days after a TIA, so act promptly if you notice slurred speech or blurry vision. Preventing and treating strokes. Seek emergency care. The first hours after a stroke are a crucial opportunity to minimize brain damage. Go to the hospital immediately or call 911. Fast action makes all the difference. Talk with your doctor. Surgery is sometimes needed, but many strokes are treated with medication and lifestyle changes. Your doctor can advise you on the best regimen for you. If you're concerned about your own risk factors for having a stroke, be proactive. Here are the top 5 things you can do to reduce your risk factors. Number 1, quit smoking. Giving up tobacco lowers your risk of stroke in addition to all the other benefits. Check out the website of the American Lung Association for tips on quitting. And number 2, lose weight. Maintaining a healthy body weight will help. Find a sensible diet you can stick with for life. We have lots of videos about diets and food in our library. Number 3, exercise. physical activity is good for your brain and waistline. Keep your circulatory system in prime condition with a half-hour aerobic workout at least a few days a week. Move your body daily, even if it's just going for a walk. Find some sort of exercise and stick to it. Number 4, eat a balanced diet. Proper nutrition provides brain cells with the fuel they need. Get most of your calories from vegetables, fruit, and whole grains. Select lean sources of protein and healthy fats. 5. Limit your alcohol consumption. Using alcohol responsibly protects you from strokes. The general guidelines are 2 drinks or less daily for men and 1 for women. Remember, prompt medical treatment is vital to improve your chances of survival and recovery after a stroke. Even better, a healthy lifestyle can significantly reduce the risk of you or a loved one ever experiencing such an event. If you enjoyed this content, check some of our other videos and playlists about your good health, and thanks for subscribing and sharing.